Hey everybody, I'm really excited to be here with my special guest co-host Theora DeBronte, who was on almost 3 years ago on episode 130, I'm sorry, 176. And she's back today to be my special guest co-host with the brilliant Dr. Emily Rowe, who's a functional medicine practitioner from Miami Beach Comprehensive Wellness Center, who does a ton of Western and Eastern modalities that we're going to get into. But first, Theora is going to jump into Dr. Rowe's personal Lyme journey, which led her to where she is today. So, Theora, if you can help me out and talk through Dr. Rowe's journey, and then we'll get right into all the good stuff with her, what she's doing now to treat people.
Yeah, absolutely. So, Dr. Rowe, did you, first of all, did you know about Lyme disease before you got it?
So, I mean, I went to medical school and I learned I graduated from the University of Miami Miller School of Medicine in 2004. And what we learned is that, if you get bit by a tick, you can get an EM bullseye rash, and then you take doxycycline for 10 days. And that there's no Lyme in Florida, and it's common in New York, Pennsylvania, but that's what I knew about Lyme. And I had lived in Pennsylvania from the time I was like about 9 years old until I was 15. So, and my mother loved to go hiking in the woods, but I suspect that I had Lyme for years before I got diagnosed. Like a lot of people, I had no idea that I had Lyme.
Okay.
Um,
Do you remember being bit?
I never remember a tick bite. However, I did have dogs, and I recall pulling a lot of ticks off my dogs.
Yeah. And
I also had cats too, and we did have, even though I'm a clean person, we had issues with flea infestations, which can happen, to the best of us. So,
yeah, so
and
when
that's an issue for Bartonella more, but I
yeah. So yeah, take us through your journey. When do you think it started for you? Were you a kid? Do you think you got it or
well, I don't know. I suspect I acquired Lyme in utero from my mother. My mother was from Pittsburgh, and like I said, she loved to go hiking in the woods. I don't have any documentation of that. It's just a clinical suspicion. I was sick my whole life as a little child, migraines, migratory joint pain, um, episodes where I was just debilitated, couldn't get out of bed for 2 weeks, and then I'd be fine and be able to go back to school. I do recall one summer after going to like nature camp in the Appalachian Mountains of West Virginia, coming home and starting high school, the 11th grade. And I would basically go to school, come home and sleep, and not happen for about 6 months. So, who knows if I caught Babesia then. I've had labs that documented infection with Borrelia, Babesia, and Bartonella. So, and then a lot of chronic viral stuff. But I didn't learn about Lyme until my husband and I were in Western Massachusetts at this yoga retreat center called Kripalu. And they have this lovely little bookstore there. And my husband picked up this book called Why Can't I Get Better by Richard Horowitz. And and this was like probably 2017. I picked up the book and I like went through the MSIDS Lyme questionnaire, which is, stands for multiple systemic infectious disease syndrome. And I took the test and like my score was 126. And I was like, oh, maybe I need to get tested for Lyme. And I knew nothing what I was doing. So I ordered I called Hygienics. I set up like an account with them. I ordered like a panel and I didn't really understand how to interpret it. At that point, though, I did have multiple bands for Borrelia and Babesia show up. And then nothing showed up for Bartonella until I started treatment years later. And then that showed up on multiple tests. But I suspect I probably had Bartonella in utero. But that was like a big game changer for me. And at the time, my husband and I were actually studying mold toxicity with Neil Nathan. He's a mentor of ours. So my husband and I, we both got exposed to mold. And I worked out of the house for years just doing acupuncture before we opened up our clinic in 2017. But at that point, I actually had like stage 4 cancer. And so I was sick and I was staying home all the time. Because I was going through cancer treatment and I was just breathing in aspergillus spores, got exposed to toxic mold, and then colonized in the nasopharynx and GI tract, like a lot of people do. And it triggered like a cascade of autoimmune problems. And then with the immune deficiency that happened between the mold toxicity and the cancer treatment, like the Lyme just had a party. And so I wasn't diagnosed, I think, with Lyme until actually 2018. And right. And then I went through a series of treatments that were very complicated. And I'm still like not 100%. I still have chronic Bartonella. I was able to clear Borrelia and Babesia, and they haven't shown up on tests for years. But yeah, I manage it. I do a lot of modalities for my own health, and I got good at this, you know, and I'm able to help a lot of other people and guide them through treatments. And I find my clients who do best kind of stack modalities, and when you really stack modalities, the healing just becomes exponential. It's not like double or triple. It's just like it's so that's and my husband and I opened up Miami Beach Comprehensive Wellness Center in 2017. We actually met in medical school in the year 2000, dissecting a cadaver. He's an OBGYN by training who now does functional medicine. And I studied internal medicine. And then I quit becoming an internist and I went back to school for acupuncture. And I have a 4-year master's degree in acupuncture and Chinese herbs. And then my husband and I we went through the whole IFMCP training, the functional medicine training in 2017, and became functional medicine providers. So yeah, we specialize in people who have complex chronic illness and for whom conventional medicine has failed. And we treat a variety of things from chronic infections, elevated toxic burden. We're treating, unfortunately, a lot of cancer these days, and a lot of autoimmune disease.
Yeah.
Hey, Dr. Rowe, I'm sorry, real quick, I just want to interrupt because I find it interesting that you have a medical degree from the University of Miami, Miami Miller School of Medicine from 2004. And then in 2009, you got your master's degree in Chinese herbal medicine. And then later on in 2018, after your own experiences, you became certified in functional medicine. But earlier on in 2004 and 2009, when you went for your medical degree and even your master's in Chinese herbal medicine, was Lyme a part of that education you received?
Not at all. No. And I practice internal medicine at St. Vincent's in New York City. And there was very little awareness of Lyme. We got no training on Lyme in Chinese medical school either. There was a concept of, chronic infections, and they do have a concept in Chinese medicine that dates back like from this textbook called the Shahan Lung, that's almost 2,000 years old, of like external pathogenic factors getting into the body and then diving into deeper layers within the body, like energetically. And so a lot of that theory can be applied to chronic Lyme, but I never knew, things like, chronic migratory joint pain might be a sign of Lyme, headaches, fatigue, the cognitive impairment, and the cyclical aspect of it all, which I think that's like, the huge red light when I have these people come in. But, I'll have patients come in for acupuncture. I had this one patient about a year and a half ago, her chiropractor sent her into me for her neck pain. And she started talking to me about all her medical problems. And like, I put my hands on her neck and I just got this, intuitive hit that she had Lyme. And I was like, have you ever heard of Lyme disease? And, we did labs, and she showed up as having chronic Lyme. And, she's got a host of complicated issues, and she's from Pennsylvania, from outside Philadelphia. But it's been an interesting journey. But no, it was not part of my medical education. I studied with ILADS and Richard Horowitz. I actually studied with Richard Horowitz first. I asked him to treat me, and he's like, no, but I'll train you and your husband. I was like, great. So we went to his like tick boot camp kind of training. He has what he calls like a really intensive structured thing for physicians that he teaches them how to treat Lyme. And then later we went and became ILADS members, and that was like going to graduate school before you go to undergraduate school, because Richard Horowitz is really intense. So he's
Yes.
fantastic, but he's like, he starts throwing all this information at you, and it's like drinking from a fire hose.
Yeah, the fact that you were able to treat, well, I shouldn't say treat, be able to, because he wouldn't treat you, which I find interesting. He told you he won't treat you, but he'll teach you, right? So that was an
Well,
interesting response you got from
yeah.
him.
No, it was fantastic though, because he gave me a skill set that I'll have the rest of my life. So it was lovely.
Yeah, and then also Dr. Neil Nathan, who's a mold expert that we hear a lot of in the community as well. So the fact that you've been able to train with those two individuals is really cool. Now, I'm curious before we get into what you're doing today with your treatments, how did you treat yourself? Once you realized you had Lyme disease and Dr. Horowitz and you met all these people and you realized you had cancer and mold toxicity and then Lyme disease on top of it and you were really unwell, what was your treatment regimen that got you to where you are today to be able to go and actually treat other people?
So, well, I never stopped working actually. The only time I stopped working was when I had thyroid cancer and I received radioactive iodine, and you're actually radioactive, so you can't be around people. But I've actually never stopped working through all of this. And I'm lucky that I was able to function well enough. Um, I did a series of very intense antibiotic regimens, and they didn't work. And so I ended up getting a PICC line, and I did a combination of multiple antibiotics. I did IV Rocephin, IV Mepron, a lot of IV methylene blue, combined with red light therapy. We have ozone. We have both major autohemotherapy, like traditional blood ozone at our office. My husband has studied with Frank Schallenberger. And then we also have what's called EBU, which is a combination of like ozone with a dialysis filter. That was incredibly helpful for me. At one point, I was extremely immune deficient, and I caught Giardia, which is an amoeba, and I had a autoimmune reaction secondary to the Giardia called Guillain-Barré while I was going through all this treatment, and I like literally couldn't walk. And within like 2 EBU treatments, the neurological problems had been like resolved enough where I could walk again.
What are you, can you spell that? Is that the same as like EBO2 or is that something
Yeah,
different?
it is the same. It stands for extracorporeal blood ozonation and oxygenation. Um, and there are different machines for EBU. We have one through a company called the Stratus that is based in the US, but they base their machines off the ones in Malaysia. There can be issues with certain machines with hemolysis, and so you can actually get like lysis of your red blood cells. And so you have to be careful with EBU. I love EBU. It's helped me a lot, but I've had other patients who received EBU and didn't have like proper screening to see if they have like glucose 6 phosphate dehydrogenase deficiency, which can set you up for hemolytic anemia. And every medical procedure needs to be an individualized risk benefit analysis. And so, at our office, we don't really follow protocols. I take the person and I look at them and their constitution, often from a Chinese medical point of view, and then I recommend medical options and let them choose. But I did a variety of treatments. I treated mold toxicity. I do a lot of supplements for autoimmune disease. I have Crohn's and autoimmune vasculitis. And then I told you guys I had the Guillain-Barré. So I've been through quite a health journey. And then I've had thyroid cancer that was metastatic stage 4, and then I've also had an early breast cancer. So yeah, and this was all, I think, secondary to one, elevated toxic burden and chemical exposures. When I was younger, I worked in a research lab working with uranium on a regular basis. But then also I think all the chronic inflammation that you get when you have all these problems kind of preoccupies your immune system, and then your immune system is not able to like get rid of cancer cells and induce apoptosis in cancer cells the way it should. And I would never say that Lyme causes cancer, but there is an association for sure.
Yeah, with the inflammation and everything. So I want to take it back for a second, if you
Sure.
don't. So you believe you got it Lyme from in vitro from your mom, and you went all these years with all of these symptoms. Did your mom ever take you to the doctor? What did they say if you went? Like, how did that work out?
So it's sad. My mom was, she was a lovely person. She was extremely smart. She was an accountant and she loved me, but she was extremely mentally ill. She met the diagnostic criteria for schizophrenia, and I suspect she had neurological Lyme and probably Bartonella. And there are associations of Bartonella with schizophrenia. And there's documented cases of people being diagnosed with schizophrenia, and then you treat the Bartonella, and the schizophrenia resolved. So she definitely took me to the doctor. My father is a general and vascular surgeon and extremely good at what he does. But I think that there's lack of knowledge in our medical system with what Lyme is. And, there was, there was no neglect. It wasn't like my parents didn't love me or didn't take me to the doctor. I think there was just knowledge gaps all over.
Absolutely. And then did they diagnose you with anything else? Because I'm sure, as you know, Lymies get misdiagnosed all the time.
Yeah, I had my worst symptoms were migraines and joint pain, and then I like I said, I had these episodes of just debilitating fatigue. I was just told that I was stressed and crazy and should take antipsychotics.
Sounds about right.
Yeah. Yeah,
I feel like,
that was right, what I had going on.
wow. Okay, so then you go through all these symptoms, you go to medical school, then you go do um get your acupuncture and get all these other additional resources at your fingertips, but still obviously you were not well enough. Come 2018, you finally get that Lyme diagnosis. And that's because you read it in a book and kind of self-diagnosed yourself.
Correct.
Oh,
Well, I
wow.
had a clinical suspicion. I didn't understand then that like Lyme is a clinical diagnosis. So I was like, oh, I need to get these test results. And then even that, I didn't really understand how to interpret the test. And so I had to like call and get help for how to interpret the test results because it is complicated. You can't, it's not like you just get a test and it's like, yes, no, you have Lyme or you don't. There is an art to the interpretation of these things where you're
Yeah.
looking.
Which test did you do?
I did like a full panel that had antibodies. And then
Mhm.
I also did, PCR and fish tests and everything. What I use a lot now in clinic that I found to be extremely helpful. I mean, I do like IGeneX, they're a great lab, but they are expensive. But I use a lot of T cell reactivity testing. And I use both Armin Labs, who's in Germany. They have an excellent test. And then I also use Infecto Labs, who's in Minnesota. And I've actually become good friends with the head immunologist at Infecto Labs. His name is Felix Schultz. And if you guys ever want to have him on your podcast, he's brilliant.
Yeah, I was just gonna say, Dr. O, we've had Armin Labs on. We've had Dr. Armin himself on the podcast, and he blew us away. So I'm smiling as you're saying this because he's brilliant, and I love him, and I love their lab. But we'd love to have Infecto on as well. So that would be a
True.
wonderful introduction.
Yeah, no, well, I use them both and they're both good labs. And yeah, and so but they have different panels. And so if somebody has spent a lot of time in Europe or something, I'll order Armin Labs because they're better for some European species. And then they have differences in which viruses they can look for. The other thing I see when patients have chronic Lyme and other tick-borne infections like Babesia, Ehrlichia, Rickettsia, whatever, the whole spiel, I also see a ton of chronic viral issues. I see a lot of chronic cytomegalovirus, which I see as one of the worst triggers for chronic inflammation. Epstein-Barr, HHV6, all sorts of things. The other thing I'm seeing a lot of, and particularly in 2022, there was a bad episode of Coxsackie virus, which is what causes hand, foot, and mouth. But I had several patients develop severe autoimmune issues when they caught Coxsackie virus. And that only showed up with Armin labs and Infecto labs. And unfortunately, I can't even order Coxsackie labs from Quest in Florida anymore. It's not available.
Of course. Okay, so can you can we go in order, or not even in order, but like list all the treatments that you did for yourself?
Oh, geez. Okay, this is going to
No,
be
as many as you can remember.
acupuncture, Chinese herbs, Western herbs. Like I used a variation of Stephen Buhner's protocol, but based on Chinese medical energetics for my constitution and my medical patterns from a Chinese medicine perspective. Did a ton of supplements. I did binders and antifungals for mold toxicity. I did supplements to treat heavy metal toxicity. I got the metal amalgams pulled out of my mouth. I did a PICC line. I've had 3 PICC lines, all of which developed cellulitis and got infected and had to be pulled. But I did a variety of IV antibiotics to treat stuff, and I got significantly better after that. I did prednisone for autoimmune disease, which is complicated because it can suppress the immune system. I took antiviral medications.
I think you said methylene blue, right? Methylene blue IVs.
Yeah. Oh, yeah. That was, well, I consider that, yeah, for sure. And methylene blue pills as well, combined with red light therapy. I did a lot of holistic detox work, like with saunas, Epsom salt baths, red light, that kind of stuff, sweating. I did a lot of yoga, meditation, and breathing. I went to school for hypnotherapy and did a series of regressions that really helped me maintain resilience and willpower to get through treatments. I told you about the Ozone and the EBU. We also have a device from Germany that is called CyberScan that basically it reads your energetic patterns and then gives you a customized homeopathic counter signal. I've used homeopathy. I think that's about it.
It's a lot.
Yeah, it's a lot. Oh, sound healing. I'm a big fan of sound healing too.
Sound healing's great. And I'm sure your process is you're still in your process, right?
Oh, definitely. Yeah, no. And like I'm as much maintenance as a Ferrari these days, like I'm in the shop all the time, but I run pretty well. So it's okay.
Yeah. So 2018 treatment started, right?
Right.
And then when would you say, by when were you starting to feel like a human again?
Oh gosh, it's so hard to say because it was like 2 steps forward, 1 step back, 2 steps forward, 1 step back. I mean, this chronic illness roller coaster. And I got better, and then I caught COVID for a patient and had long COVID, and then I got better, and then I did a crazy intense Bartonella treatment and had like a bad reaction called Adresse syndrome, and had to take high amounts of prednisone. And then while I was on that treatment, I caught viral infections that cause a viral myocarditis. And I mean, it's a roller coaster ride, and that none of this stuff it's not like there's like this smooth kind of thing. I think I'm very lucky that I've been able to have access to all this stuff and figure stuff out. And I'm very blessed that, oops, we lost our host. That I'm sure he'll be back on.
Yeah.
But I'm very lucky that I had my husband to help me as well, because I would be developing a problem, and we would sit down and think it out and figure out what's the best course of action and stuff like that. And so I've managed to avoid hospitalization, avoid any major medical issues.
Wow.
So I feel really lucky that I have, like, I basically created this clinic to treat me and then other people going through similar things. So I feel really just lucky.
It's amazing that you've been able to create that and, be able to
Right.
support other people where there isn't a lot of information available. There's not a lot of support. There's not a lot of answers. So
Right. And I don't have a distinct turning point for when I got better. I do have a distinct turning point for when I got worse, and that was mold exposure. As soon
yeah,
as like I got exposed to the mold, it was just,
yikes. You know what they say about healing though? It's like,
yeah, for sure. And that's why when you asked me, when did you start feeling human again? I was like, well, I don't know. Because it was such a rocky road, you know?
yeah. I mean, I think when I say that, I mean, because, I've gone through my own stuff too, and I didn't realize how bad I was until I started feeling what I call human again, which for me was like that turning point of when I could learn. There was a
Yes.
long time when I couldn't learn and I couldn't remember, and I didn't realize that until I started to be able to learn again. And then I was like, oh,
To me, the worst part, I agree with you, was the cognitive impairment and brain fog, and then the fatigue. And I had a list of things I wanted to do, but I was just too tired and sick to do them. And I had like other doctors tell me I was depressed. I'm like, no, I'm not depressed. Depressed people don't want to do things. Like, that's the definition of depression, is anhedonia, meaning nothing in life gives you pleasure. I had all these things I was interested and wanted to do, and just didn't have the reserves to enjoy life and do all the things I wanted to do.
understandable.
Yeah, right. I know you guys both get it, and it's like that whole analogy, like, how many teaspoons of energy do you have today? What's a priority? What are you going to get done?
But I really like that statement, Dr. Rowe, because a lot of people listening to this podcast have been told or being told that maybe you're just depressed, maybe you're just anxious. And I like your answer, which is no. If I were depressed, I wouldn't want to do things. I want to, but I do not have the energy to. And I think the words you just used are very good for our listeners to almost jot down and use, because it's hard to explain to people that you're not depressed when you're so sick. And then people will dismiss you and not want to help you if they think it's mental health only. And I think that's a really good tool you just gave us to share with people to fight past that barrier of it's more than just me feeling a little down and under the weather, right? With my mental health. So that's a good tip. But I also wanted to ask you about your prednisone, because you mentioned earlier that you did take prednisone as part of your healing journey. And for me, when I took prednisone, it actually set me back greatly in my healing journey. And I think I was so immunocompromised. So how did prednisone impact you, and how do you view it now that you have more knowledge about Lyme and the immune system, fast forward a couple of years?
Well, I think there is a place for it. I think it is overprescribed for sure. But I have a chronic autoimmune issues, and I developed a problem called temporal arteritis, which arterial inflammation is common when you have Bartonella. Bartonella loves to live in the endothelial lining of the blood vessels. So Bartonella is transmitted by ticks, but also fleas, mosquitoes, sandflies. So, and particularly with cat lovers. My mother had 9 cats when I was a kid growing up, and she did a lot of rescue of animals. She was a very kind, sweet person. And I suspect I got Bartonella as a little kid. But Bartonella in particular has an affinity to the inner lining of the blood vessels. And Dr. Mosiani, who is big in ILADs, he specializes in treatment of Bartonella. And the reason why he got into Bartonella is he was studying what's called small vessel disease, which is inflammation of the capillaries. And so when you have chronic Bartonella, it sets you up to have all these problems with circulation and blood vessels and stuff like that. But I actually developed a problem called temporal arteritis. So the temporal artery goes around the eye here, and it supplies the eye. And when you get an autoimmune attack on that blood vessel, you can go blind. And it's very serious. So the treatment is prednisone. And so my option was either to go blind or to take prednisone. And so,
That's a pretty easy decision there, I guess, right?
right. And I did have, like, multiple immune system issues. I had an IgG subclass 1 and 3 deficiency. My CD57 was low. I had a CD19 deficiency. So there was multiple immune problems going on, but I knew that I had to treat the temporal arteritis. I had tried another medication, which my husband and I debated, and we talked to, an ophthalmologist, that is used sometimes for temporal arteritis, called methotrexate, but it's equally scary. It's a cancer medication. It's an old chemotherapy, and it didn't work for me. And prednisone ended up working and saved my vision. So thank God I had prednisone. Now I weaned down to a low dose as quickly as I could. And it's such a tightrope to walk this stuff when you have autoimmune reactions with this. And part of the theory in functional medicine is when you have something like Bartonella or Borrelia, which, and Bartonella in particular, it's what we call an obligate intracellular parasite. So what that means is it has to live inside your cells. And so when you have some bacteria living inside your cells, what does your immune system do? It attacks your own cells. And so you get this chronic, attack on yourself because of this intracellular pathogen. I see a lot of autoimmune mediated driven stuff with Borrelia, but particularly with Bartonella.
Yeah, I'm be curious about you keep bringing up Bartonella, which is I think a really important topic here because it's way more than just Lyme disease, as we know. There's a lot of co-infections like Bartonella that can be very severe, and then other things like mold toxicity, potentially cancer overlaps, like you mentioned, and also viruses and opportunistic things that come to light when we're immune compromised. And you mentioned like toxoplasmosis is one, and there's some others, right? Epstein-Barr virus, HPV6, all that kind of stuff. So the question I have for you is Bartonella in particular can be gnarly, right? We had researcher Ed Breitschwert on to talk about it. We've had a lot of experts come on and talk about Bartonella and specifically the mental health impacts. We've talked about Bartonella rage. We've heard about Lyme rage, but a lot of people have said Bart rage is worse than Lyme rage. And Bartonella does more to the brain than Lyme. And when it comes to things like schizophrenia and mental health and things that almost mimic real psychiatric conditions, Bartonella can be the root cause potentially. So what are your thoughts on that? Have you digged into that at all? And do you agree with some of those statements?
Yeah, I definitely, that's one of the clinical suspicions why I suspect my mother had chronic Bartonella. I mean, she's been dead many years, so it's impossible to know, but there's speculation, and who knows, maybe that's just me wanting there to be a reason other than just that she was schizophrenic and severely mentally ill. But I've seen it in patients. I've seen them come in and they're extremely irritable and they're like, this isn't like me. And I know I'm really not like this. And you start treating with things like methylene blue and the rage and the irritability gets better. I've had clients who have had severe road rage. That was, a lot driven by chronic infections. Yeah, it's very interesting. The key things that trigger the thoughts for me that a client has Bartonella, they end up with horrendous foot pain. And they have trouble describing it often, but they have this pain in their feet that is difficult to describe. Often there's cystitis pictures. I never had that, but they'll have bladder symptoms. So they have chronic burning urination, this and that. Now Lyme, and I'm speaking specifically of Borrelia, can also colonize the uroepithelium, which is the inner lining of the bladder. But I find that Bartonella in particular will inflame the bladder. The other clue that somebody has Bartonella is there's these marks on the skin that look like stretch marks. And, you can go to YouTube and Google like Bartonella striae. And the key to how you know that it's Bartonella and not just stretch marks is regular stretch marks follow what we call Mees lines. It's spelled MEES. And it's the lines they use in plastic surgery to like hide scars so that they tuck into these folds. And usually if somebody has Bartonella, they'll have stria on the skin. I've seen them in women on the chest, on the glutes, and then in men in particular, we'll get them on their posterior shoulders here and like the love handles areas. So those are the big clinical clues that somebody may have chronic Bartonella for me. That and often there's some people get, you know, anger, irritability, rage, but some people more just have like this frenzy, like anxiety that can be associated with it. Like I said, I feel really lucky that thank God my symptoms neurocognitively were never as bad as my mother. I never had psychotic breaks or anything like that, but I definitely had irritability and episodes of insomnia, trouble focusing, that kind of stuff. But it all got better and went away when I treated everything. Thank God.
Yeah, Theora, I want to give you, I know you're going to speak too, but Theora posted a reel that I remember from 2 years ago that we shared, and I still love the reel about insomnia and Lyme disease. And it's somebody in the middle of the night, just like getting up and dancing on their bed because they just can't sleep, right?
Yes.
And you got to go look at it because I'm not doing it any justice, but it's hysterical and extremely relatable. I know you want to jump in, Theora, but I had to share your
No,
reel because I want
no,
people to go watch
please.
it because you get a little comedy about relating to it, you know?
Oh God. Well, I have a very dark sense of humor and I made a lot of jokes and it helped me deal with all of it, you know. I always joke that I'm tough to kill. And at one point I would say that I'm not delicate like a flower, I'm delicate like a bomb, you know. There was like this, like, you know, you just walk that edge and one thing hit you like a common cold and boom, you'd be down for 3 or 4 weeks. Oh, I forgot to mention too, you asked me all the treatments that I did. You know what was a huge thing for me that I don't know how I forgot? Peptide injections. That was a game changer for me. And it got rid of my chronic pain. And I had chronic pain since I was a small child and migraines and stuff like that. But in particular, I took courses through A4M and particularly Kent Holtorf. I mean, he's quite a character and he's had Lyme himself. He's a physician who teaches peptides.
We've had Dr. Holtorf on and a lot of his colleagues from the Holtorf Medical Center, but can you repeat what were the peptides you just said? That because I
Sure.
know a lot of people are going to be asking what
Yeah,
specific peptides because there's different types.
I used so and I learned from his lectures, Kent Holtorf. He's got great lectures on A4M, but in particular, I used a combination of BPC 157, TB4 frag, thymosin alpha 1, KPV helped me a lot with my Crohn's. I used CMAX to bring my brain back. That was magical. That was just absolutely magical. I use CJC ipamorelin to reset the pituitary gland after all the hormonal imbalance. I use kisspeptin to help with hormonal imbalance. So I've used and not all simultaneously. And with peptides, they are cell signaling molecules. So what they do is they, can cross into the membrane of the cell and send signals to the cell and DNA about what to release and stuff like that. But so they should never be taken continuously. The way you take peptides is you pulse them. That's the appropriate way to do. So a lot of times you'll do like 5 days on, 2 days off. So like Monday through Friday, or you'll do a series of like, I also used epitalin, and I will do that for a month, twice a year. That's a longevity peptide that helps with pituitary balance for the whole HPA axis. So yeah, that's been a game changer. We are now offering this really cutting edge service at our office that's called Neo 7. And I'm in our office, I'm the first patient that's done Neo 7. But basically what we do is we draw blood and send urine samples, and they look at what DNA is being transcribed, what RNA is being translated, and what proteins are in your blood and urine that are contributing to chronic inflammation. And then based on what's going on, they custom tailor peptides for you, and they augment them, which means they put like a couple amino acids on to send it to a specific spot, either in the cell or the DNA. It's amazing, and really been a huge game changer in my health.
Wow. So for the peptides, were you doing that all along, or did that come later?
That came later. That didn't come until last year, 2023. And it was miraculous for me, because even after all the treatment, clearing, even after clearing Borrelia and Babesia, I still had a lot of chronic joint pain and autoimmune processes, and the peptides were a game changer. I mean, pain that I didn't realize I had went away. And then it was like, oh, wow, it's so much easier to like think and do things and be interested in the world when your pain is gone, you know?
And you feel better, right?
And the psychological impact that pain has. I didn't realize how much the pain was impacting me until the pain was gone.
Yep.
Yeah, I
Yeah.
feel like peptides weren't, nobody was talking about them about that time you were getting treated. You got diagnosed 2018. I was treated in 2019. And I've just heard amazing things about them. Sounds like they would be very beneficial, like you said, especially at this point where, because I think one thing that is definitely a misconception is like, oh, you get treated for Lyme and then you're better, right? And it's like, no, like there is all of this like residual stuff that's been sitting around waiting to be taken care of. And it's kind of like this really long checklist where, people are like, how have you been treating yourself for 5, 6, 7 years? And it's like, well, there's still more. Like there's been all this stuff. It's like the collateral damage, right? Of everything else. So I think
I cannot agree with you more. The chronic inflammatory processes just really imbalance the physiology of the whole body. And it takes a lot of work and a lot of time.
yeah. And I think the world doesn't understand that. The people who are dealing with it, we get it, but it's hard for people to be like, "Oh, but you're better now." And it's like, and I'm sure you had the
Yeah,
same
and
experience. They're like,
this
"You
is
look fine."
complicated, right? And you know, it's such an art to talk to somebody, because you don't never want to ruin. You never want to like be unrealistic and give somebody false hope, but you never want to take away their hope either.
Yeah.
And so, like, I have this client. She's lovely. She's in her 60s, and she's got a binge eating disorder, and she's diabetic, and she's abused her body for years. And she basically got to the point where she was scared because she started having renal problems. And I was like, look, you're looking at dialysis here. And she's been on I think it really like just flipped something in her brain. And she started getting psychological therapy to help support her and stuff like that. But she's changed her diet, and it's been like 2.5, 3 months, and she's super strict. And she's like, the weight's not coming off. And I'm like, you've abused your body for 40 years. It's not just going to go away in 3 months, And and then, thank God I was always focused on holistic health and, things like lifestyle, and I stayed, I think luckily I was able to stay active as much as I could. And like, even when I had like the temporal arteritis and the double vision, I made sure to do like yoga, and I did because it would help me know where my body was in space and help me with balance. And even with neuropathy in my feet from Bartonella, I made sure to do all that stuff to the capacity I could do. But and I suspect if I hadn't striven so hard to be healthy my whole life, I probably would be dead or in the hospital, or who knows where. Just totally debilitated, right?
I don't want to just like anyone listening, I don't want to discourage them, because it's like, yes, it's kind of peeling the layers back of the onion, right? But I know I can attest from my experience where it's like, even that little bit that you start to feel better along the way is like enough in the time, right? It's like, okay. And that's why sounds like for you, for all of us, when we continue these journeys, even though it might take many years, but you're right. Like and not everyone's abused their body, like,
No, no, not at all. Not at all.
right.
But you
But
know,
we've
like
been sick for so long without knowing it, and it's been all this, wreaking havoc on our bodies, and we're living in a toxic environment, and because the world we live in is toxic, right? We've got pollutants, we've got people, even the scents, the cleaning products, the food. I mean, it's just tough to be a normal, healthy individual in the environment that we've created. The light, the air, the food, the water, it's all things. So then you get, some type of chronic illness on top of it. And yeah, it's going to take some time.
it's a lot to negotiate and navigate, and I feel like it's a complicated process. And I can't even tell you, my husband and I see this all the time. We have patients who are feeling much better, and then we don't see them for like 9 months, a year, and then they come in and they're a wreck again. We're like, what happened? They're like, oh, well, I stopped doing my diet, I stopped doing my exercise, I took this really tough project, or something complicated happens, like a death in the family, or they're taking care of a loved one who's sick, or things happen, right?
Life happens. Yeah.
Yeah, life happens, but all of a sudden they stop taking care of themselves, and they're just like, and it's not like they're back to where they were before, and it's so much easier because now you know what works for the person and what to do, and how to support them, and so they get better much quicker. But there is a certain level of maintenance that this stuff requires, and I don't want to be pessimistic, but I do want to be honest with people.
Yeah.
It never really just goes away.
Like
Yeah,
you
but
said, you're a Ferrari, right? And then
yes.
you're a high maintenance vehicle. We're all high. That's the way I've always said, I'm a high maintenance vehicle. I have to go in for tune-ups often. Like, it's okay.
Yeah, the one thing I want to highlight there is I completely agree, but I think the important note there is it doesn't mean you can't feel better and enjoy your life. And I think the most important lesson I've learned is the key word you mentioned, Dr. Rowe, which is maintenance, right? You're going to feel better, but I learned this early on. I think it was like our 20th podcast guest. She gave us a story where she was really sick, debilitated, started feeling better, went out every night, was partying, young in her 20s in the Netherlands, went out every night, was drinking alcohol, eating bad foods, and then got sick again and had a relapse. And she shared with us, she realized it was her lifestyle, and she had to live a healthier lifestyle to sustain the level of health she was able to achieve, right? So I think for me, it's, you're never going to be able to fully eliminate your stress, but you have to realize there's a balance. Your sleep is important, your stress is important, your personal relationships are important, your diet is important, right? All these things are important. Your nervous system is important. So you have to find tools to help you stay in a good place. Otherwise, you're going to have a setback. And I think that's true for everybody. Even healthy people, quote unquote healthy people, will have their limit where they're going to have a crash, right? But I think our ceiling is a little bit lower after we've had chronic Lyme, but it doesn't mean we can't sustain a healthy, happy life if we reach that level and continue to maintain good health practices, right? I mean, what do you guys think about that?
I fully agree with you. And one other thing I wanted to say to touch on that is, like, you know, mindset is so important, but for me, it's always been like, okay, I feel grateful that I have, we'll call it whatever, a condition that forces me to stay healthy. And I'm grateful for that. Like, yes, it's like a get to, right? Like, I get to eat good food, and I get to make sure my water is purified, and I get to, you know, protect myself as best I possibly can with all the toxins, and make sure that I do keep up on my acupuncture and, all the stuff, the high maintenance vehicle. And it's, that's just my life at this point. And I'm grateful for that, because who knows where I'd be if I wasn't.
Yeah.
I
And
always say, I always say that Bartonella has been my greatest spiritual teacher,
yeah,
Yeah.
because and it's given me an amazing skill set to help other people and guide them through. And because in our clinic, my husband and I don't recommend things that I wouldn't do myself, or that he wouldn't do himself. And so every treatment that we have in our office, I've done personally. And that was one of the problems when I worked in conventional internal medicine, is I would prescribe these medications that I would never take.
Yep.
And I had like issues with personal integrity. I really had trouble working in the situation, and it's a big part of why I quit.
Yeah. Dr. Rowe, let's talk about some of the things you're doing now, right? Because there's some really cool topics I want to just get into a little bit with you, which is, like one of them is hypnotherapy. And I'll be honest, at first, especially before I got sick, I was very much a Western guy. I wasn't into this whole Eastern world. Now I've come a long way. But hypnotherapy, you think of as like this like woo-woo thing where somebody gets up on stage and they, hypnotize you and make you quack like a duck, right? It's way deeper than that. So can you just give us an idea as some of these more Eastern alternative practices like hypnotherapy, how they can be used in a healing environment like your practice?
Yeah, so one of the big things, and honestly, all humans go into trance or like altered healing states daily. And so a lot of times if there's something you like to do, like I love to draw pictures. And so I'll draw like pictures of nature and stuff like that. And I'll kind of go into this like light meditative state. But if you're ever like so wrapped up in a book that somebody comes in the room and they're talking to you and you don't hear them, or like, you're focused on a TV show, and that's a type of trance state. And basically what hypnosis is, it's trance state with a goal. And so, you have a goal of being healthy. And so you visualize yourself as full of vitality. And there was a certain point, and I don't know if you guys have been there, but I was definitely there, where I was so sick that I couldn't even imagine myself being well. And it was a very dark place. It was terrible. And I was like, well, here I am now at this age 35. What am I going to be like when I'm like 80? How is this going to happen? And I'm 48 now, but that's when I knew I needed to really like focus on deep subconscious beliefs. And I've had people who have gone through multiple treatments with very good practitioners. And I look at the protocols, and the protocols are excellent, and they aren't better. And sometimes, and I would say it's never in somebody's head, but sometimes they've had a lot of psychological trauma. Sometimes there's issues of worthiness. Sometimes there's just a difficulty sticking to a treatment plan, because like if you're taking medications 3 times a day and supplements, and you're doing a special diet, and it can be all consuming, and it requires a certain level of resilience and willpower. And the hypnosis can help you visualize where you want to be and what action steps you need to take. And really the thought is that we get so focused on willpower in our society, and like, oh, they just don't have the willpower. But if you feel like going to the gym, it's not an effort. You just go, and you feel better, and it's fantastic. But if it's like you'd rather, like, you feel like sitting on the couch and eating potato chips and watching Netflix, maybe you'll go to the gym once or twice, but eventually the willpower just gives out. And so you look at what's driving those feelings, and often what's driving those feelings is beliefs, and beliefs are things that are embedded in your subconscious that may or may not be true. And so I had a belief that I couldn't get better, and I had to like shift that, and I knew I had to shift that, and that's why I went to hypnosis school. And so I got degree in medical clinical medical hypnosis support. And I found that helps a lot of my patients when they know they want to quit vaping, they know they want to quit smoking, they know they need to, eat a specific diet that's based on, their individual, constitution, but they're having trouble just doing it. And that's where the hypnosis can come in. I also found limbic system retraining was very helpful for me. I've done a couple different programs. I did DNRS. It helped me with food reactions, DNRS. I also did Gupta. That was a lovely set of meditations. And I've done primal trust as well. And they all have their strengths and weaknesses, and they'll have, I have like, I don't think they're the be all end all and the cure for everything, but they definitely helped facilitate, the medications and antibiotics to work, and the other treatments that I did.
Yeah. Dr. Kathleen King was on the podcast from Primal Trust, and she blew us away with, same thing. You hear these concepts, brain retraining. Well, what does that mean? And once you learn about it, you get fascinated by the science behind it and the stories and the success stories, right? And all these things together are really, really powerful. So I'd like to drill into another topic that you kind of talk about a lot on your media platforms, which is shamanism, right? What is shamanism, and how do you use it in your practice?
Um, so, so shamanism is probably one of the oldest forms of healing. And the thought is, again, and we're here talking about altered healing trance states. A shaman is somebody who can walk between two worlds. And that's the Chinese character for shaman. I wish I could draw it for you guys. It's a horizontal line, a vertical line, and another horizontal line. And then there's two people on either side. And it's basically somebody who can walk between the celestial forces and the terrestrial forces of the earth. And I have found parasitic behavior in clients. So, for example, I'll give you a very concrete biological example. You mentioned toxoplasmosis before. Toxoplasmosis is an infection that can be carried by cats, and it can also be transmitted to rats. And rats are normally will normally avoid the urine of cats because they're like, oh shit, there's a cat around. I don't want to get eaten. I'm not going to go near that urine. When rats get infected with toxoplasmosis, they change their behavior. The toxoplasmosis actually changes the biochemistry of the brain so that they're attracted to cat urine, so that the parasite can complete its life cycle. And I've seen people have these strange self-destructive behaviors that happen with chronic things like Lyme. And I think there is some sort of energetic shift with the parasite that causes you to have self-destructive behavior. And the shamanic stuff can help clear that in a very deep way. And I don't really understand scientifically why it works. I've just seen miraculous things happen. I visualize entities very similar to viruses. There are things that are there that are, stealing your energy, stealing your chi, and maybe they're physical, maybe they're not. But there can be some entity clearing that can facilitate you to have just access to your healing potential.
Yeah, Dr. Rowe, the other thing I'm thinking about here is you're talking about the parasite, which is fascinating, right? And how it literally changes the behavior and this sort of innate knowing that rats have. But I feel like with mold, we see something similar because we had Dr. Jill Carnahan on who explained to us how mold can literally trigger different emotions in people, and how we see this with other things that are common with chronic Lyme as well. But different species of mold actually cause different emotional responses or changes in behavior in people. So she talked
Yes.
about this one house that had this type of mold where, in one family it was homicide, and the next family it was a suicide, where it caused these like violent ideations in these people that live there. They did a study of the house and found this like an abundance of a type of mold that was known with aggressive behavior, right? Another type of mold that's associated to anxious behavior or things like that. So I feel like between the parasitic component, between the mold component, and between all these things, even with the bacteria and the viruses changing our behavior, it's really hard to determine what's causing what, right? And I think that's what you're describing here. There's so many factors at play.
Well, and it's honestly, it's philosophically fascinating. I mean, now that we have all this access about the microbiome in the gut, for example, like let's say you can't absorb your vitamin A, or you can't convert beta carotene into vitamin A. There's a bacteria that can do that. And if it's, living in your gut and helping you, you're able to do that. And then the question becomes, well, what's me and what's not me? And how do I separate myself from my environment? And we really can't. And then this is where you can get into the bigger ecological pictures of Lyme. Part of why Lyme has become such an issue is, we've destroyed like the ecology. So deer are now in the suburbs, and I think people have become the new reservoirs for Borrelia.
Yeah. So, the other thing I wanted to touch on, you mentioned it earlier, is vibrational healing. So, can you share with us what that means and how you use it in your practice as well?
Yeah, so I'm by training, I'm an acupuncturist, and acupuncture works by inserting needles into these specific anatomical locations in the body. And acupuncture points are basically like highways or they're the access to the highway. There's places where you can get on and off like the acupuncture highway. So it's like there's an entry and exit ramp. And they've done studies in Germany that show that acupuncture runs in fascia. And they actually did a study where they would like inject an acupuncture point with radioactive nuclear isotopes, and you would do images at like 5 minutes, 10 minutes, 15 minutes, and you could see the radioactive nucleotide going down the acupuncture channel. And so the acupuncture channels have an anatomy that runs in the fascia. And fascia is made of collagen, and collagen is like so special and beautiful. It's a triple helix. DNA is a double helix. Collagen is a triple helix, and collagen is made of vitamin C and your branch chain amino acids, which is leucine, isoleucine, and valine. And part of the problem with Lyme is it makes an enzyme called collagenase. So it basically eats your fascia and your collagen, which is part of what mediates like the joint pain. But what's really special about collagen is it's a crystal, and it actually has what's called a piezoelectric effect. And the piezoelectric effect is a physics property where when you press on something with mechanical force, like inserting an acupuncture needle or putting a tuning fork on the fascia, you release a flow of electricity. So just to repeat that, you press on it with mechanical force, you release a flow of electricity. And I think this is part of where people with chronic Lyme and chronic viral issues and mold toxicity, this is why they get electromagnetic field sensitivity, is because of collagen, which is a huge conductor of electromagnetic fields. I mean, our biggest electromagnetic field in the body is the heart, right? The heart has this intrinsic pulse, this ability to spark electricity at 60 beats a minute or however fast your heart rate's. But then the second biggest is the brain and the spinal cord and the nervous system. And then your third is your fascia. But I see vibrational energy amazingly treat the fascia. When you apply mechanical force, you're shifting the electromagnetic fields of the body.
And what is that really doing? Is it opening up your body and clearing up blockages? I'm just trying to, in my mind, envision what that does, right?
Yeah, I think there's definitely blockage. Sometimes, for example, a common thing I see in chronic Lyme, definitely Babesia and Borrelia and Bartonella, is stiff neck, right? And the neck, like you'll palpate it, and it's like there's these Rice Krispies under the skin. Everything's like adhered and stuck. Those are actually adhesions in the fascia that can happen with chronic Lyme. And part of what mediates that is you end up with this chronic low level meningitis from the neurologic Lyme. And when we were in med school, part of how you diagnose meningitis is you have somebody bend their chin down and touch their chin, and then you have them like curl like into a fetal position or like a frog. And if they have pain, that's a sign of meningitis. And so like in little kids, like if a 2-year-old comes in and they can't communicate to you, you bend them up like in a little frog, and if they're screaming, that's how you need to do a spinal tap and look at cerebral spinal fluid for meningitis. And of course there's other symptoms as well. Now in conventional medicine, this is usually like a big deal and like something like, holy shit, you have to be hospitalized. But I suspect that there's a lot of low level mild chronic meningitis that goes on with like the Lyme world. And I think part of what the vibrational stuff does is it breaks up all those adhesions in the fascia, very similar to acupuncture, but a lot of people are afraid of needles. A lot of people have pain with needles. And by using like the vibrational therapies, it's so gentle and it's so soothing. particularly when you do it on certain points, you can go into a deeply meditative hypnotic state without having to like, count somebody into hypnosis or anything like that. It's profoundly activating for the healing states of the body, though. That's what I find.
As you're talking, I'm feeling myself more relaxed. Just as you describe it, Dr. Rowe, you are an amazing
I'm
explanation.
thinking the same. Dave, I'm like, wow, I feel so relaxed and meditative.
Yes. Like, I can't even imagine what
You
it's like
should
to be
come to
treated by
Miami
you.
Beach. We'll do a group sound healing. It's
Oh, I love that.
So you also talk about flower and tree essences. I read up a lot on your marketing literature. So is that along this, you kind of grouped it with sound healing and flower and tree essences. Are they separate? I don't even really know what that means, honestly. So if you can share with us what that means.
Sure. Flower essences, you actually will pick flowers and take them and put them in a bowl of water and put the water out in light. And water is I'm like a physics dork. I actually started out as a physics major before I went to medical school. And then I switched my major to biology. But water is very special. When sunlight hits water, it forms this thing that's called the fourth state of water. And so we normally think of water as H2O, and you have, your frozen state, your liquid state, and then your gaseous vapor state. But there's a fourth state of water that's called hydromium, which is basically H3O plus. And when water hits light, the water will actually create like crystal type patterns, kind of like a buckyball, if you can imagine that. And this is what we call plasma. And there's some at every biological membrane in the body, like a cell membrane or a nuclear membrane, when water is exposed to this, it will also form this fourth state of plasma. But this is where water is a mediator of the essence of the plant and stuff like that. So I use them energetically. Flower essences in particular are good for any symptoms from the neck up. So stiff neck pain, any neurocognitive stuff, any issues with like long COVID, like anosmia, so issues smelling post-COVID, chronic eye infections. I've had a lot of people with chronic sore throats after having Lyme, tinnitus, all sorts of stuff. Any symptoms in the head, I use flower essences for. And if you think of the flower, they're kind of like the top of the plant. And then I use tree and root essences for more like lower body issues.
How does that work? Do you mix them together and they drink it? Like, what's the actual, how do they take it,
So there's companies that make them, and usually they're preserved in a little bit of brandy. I personally can't tolerate any alcohol at all. So if I do a flower essence, I'll put like a few drops in a cup of hot water and then let the alcohol steam off. Because I'm really intolerant to alcohol after all the medical stuff that I've been through. It used to not be that way. But yeah, that's how I usually administer them. There's companies that make them. I do make my own for myself, but I can't sell them in clinic because they're not like properly packaged and stuff like that. So
you put it in water and drink it.
Mhm.
Okay.
I like it. So, you talked about Dr. Rowe earlier with acupuncture and all that. I forgot to ask you on your our previous discussion before the flower and tree essence. You talked a little about cupping and other techniques for acupuncture. So how, like we see videos of this on social media, right? And people say it's super, super helpful for them. What does it do, and how does it help people with chronic Lyme? And I believe the other term was, I'm probably going to butcher it. I'll let you just spell it. Gua Sha, Gua Sha.
Oh, you said it perfect. Gua Sha.
Okay.
So Gua Sha is you take like a jade. Well, you take these instruments and you just scrape along the skin, and like I was saying, the fascia. So fascia is your connective tissue. And if you, the way you can think about fascia is if you ever like cook a piece of chicken that has skin on it and you take the skin off and there's that like rubbery part that's holding the skin onto the muscle, that's fascia. That's the fascia of the chicken. And, people have fascia too. And fascia is your connective tissue, and it's between your muscles. It's around your liver. It's in your peritoneum and inside the abdomen. It surrounds your aorta. Fascia is what holds us together. And you can kind of think of it as this giant web inside of the body. And part of what happens is the fascia gets adhesed. And so cupping is kind of like a massage, but instead of pushing, you pull. I use fire cupping, which is like the old fashioned type. So I'll take a glass cup, hold the flame inside, quickly remove the flame. And then before the oxygen can rush back into the air, I put it on the body. So, so you're not putting the flame anywhere near the skin. You're just removing the oxygen from the air inside the cup, and then you slap the cup on. And I'll put oil on the skin, and then what I'll do is I'll slide the cup. And instead of pushing like a massage does, it pulls, and you have all these layers. You have your skin, your fascia, your muscle, and what it does is it separates the layers and allows them to slide properly. And so it'll break up all those adhesions in the fascia that can lead to chronic pain. And Gua Sha is similar. It's a skin scraping technique. So you just scrape lightly. You may have heard of Grafton technique. So Grafton technique is essentially Gua Sha, except that they won't let acupuncturists get certified in Grafton technique. And they have this really good marketing for a special device. And then you get your Grafton certification. And Grafton helps a lot of people. So does Gua Sha. But I think it's funny when somebody takes something that's been around thousands of years and names it and marks it. That's all.
Yeah. So we're talking about connective tissue and fascia. One of the things we hear a lot about in the Lyme community is Ehlers-Danlos syndrome, EDS, is very commonly associated with chronic Lyme. And for whatever reason, a large portion of the Lyme community has a co-diagnosis of EDS. What are your thoughts on that? Do you think there's a relationship? And if you can give us an idea of what your thoughts are as to why so many Lyme patients have EDS, especially considering it has to do with the fascia and everything you're so specialized in that you just described.
Yeah, this is a very interesting question. I suspect I'm on the EDS spectrum. Now, there's a scale. It's called the Beighton score, and it's things like, can you bend your thumb back and touch here, which I can't do, but there's other things. I studied ballet and gymnastics when I was a kid, and that's associated with Ehlers-Danlos is super bendy. The interesting thing about Ehlers-Danlos, it's they've now like divided it into like 17 different subtypes, right? And I suspect there's genetic predisposition to have like collagen that's extra elastic. And then when you get a chronic infection like Lyme that produces collagenase, literally it's an enzyme that eats apart your collagen. And so I've seen cases where people had Ehlers-Danlos, connective tissue disorders, and met the criteria for Ehlers-Danlos, and then you treat them for either Lyme or Bartonella, and then they no longer meet the diagnostic criteria for it. So, but I think there's a spectrum of severity. There is like very serious ones where you can have versions of Ehlers-Danlos where you can have issues with the collagen around your aorta. And so your aorta can get extra stretchy. And when your aorta stretches too much, they call it an aortic aneurysm. And so, that can be extremely serious. Now, most people who have Ehlers-Danlos don't have that subtype. There's genetic testing for it, and it would be good to know it so you can, get screened and stuff with the proper imaging studies. But I suspect there's a lot of genetic predisposition for why some people get chronically ill and others don't. And then this is not just, Ehlers-Danlos. Like there's some recent research out that shows that people who have chronic Lyme have deficiency in tertiary bile acids. And so things like ox bile can be super helpful. And so, there's often associated with Lyme an intrinsic problem with gallbladder function. And the gallbladder is so important in your whole gastrointestinal tract, and which is, a huge barrier. So it's fascinating. And then, they've done studies of there was a gene called CCR5, and certain people who survived the plague in Europe had this special type of CCR5 a single nucleotide polymorphism, and it made them immune to HIV.
Wow.
Yeah. So I mean, Lyme's not the only infection that's like this. I have a feeling that a lot of infections are this way. This is where theories of miasms in homeopathy are extremely interesting. So homeopathy has this theory that certain people have affinities for certain diseases. So for example, my husband and I, we've been married for several years. Like I said, we met in medical school in the year 2000. He's had H. pylori about 8 times, and me with my immune deficiency, I've never caught his H. pylori, never once. And I do these GI maps where they do DNA testing, and like you would think, oh, this girl, she's had all these infections and immune deficiencies and all these problems, and then he's never caught any of the other infections that I've had. So we have like distinct constitutional tendencies towards certain illnesses. And I suspect it's complicated going back through bloodlines, what our ancestors have survived.
Yeah, and I think a lot of this is genetic based that we're starting to get some data into, but we're barely scratching the surface as far as the actual scientific answer to this, other than intuitively, people have been doing this forever. And that's what you're doing, Dr. O, right? You're making these intuitive assumptions or reviews, expert reviews of your patients. We had Bob Miller on, who's a naturopathic doctor who does a lot
He's
of
a smart guy. Oh my gosh, he's smart.
he blew us away. And yeah, that's why I feel like, he's probably one of the leaders in this space, but even he said, like, we have a long ways to go. I can do all this testing, I can help Lyme patients identify, genetic predispositions and what things they can do. And sometimes it's just simple dietary changes, lifestyle changes, supplements, whatever, to help balance out some of your deficiencies. But you need to know what those deficiencies are to try to provide a remedy. And if you can provide a remedy, something as simple as a vitamin, you might be able to have such a drastic impact on your overall health. But everybody's different, right? And that's the case there. Without real testing, we won't know unless we're in tune with our body or have people to help us, figure those things out. But I suspect that your point with Ehlers-Danlos syndrome is true, right? Where it's something that maybe people are more likely to have issues with their collagen being more loose or, like rubber bandy. And then with Lyme, which eats collagen and causes collagen problems, it just makes the problem even worse than it was based on your genetics. And that's why many people have an overlap of Lyme and Ehlers-Danlos syndrome, because they compound each other, I feel like, right? And that's kind of, I think, what you're saying here.
Yeah, and I think there's a spectrum of severity as well, and I also think, like you said, we're just scratching the surface with genetics, but I think the next step is what's going to be called metabolomics. So what DNA are you actually transcribing? What RNA is being translated, and what proteins are being made? And this is where, like, the peptide treatment that I told you about, Neo7, is going to be really cutting edge, because it's looking at how to modulate that, which is absolutely fascinating.
Yeah, I did want to touch on the hormone. I'm sorry, Theo, did you have a question?
Just no, I was just saying I need that.
Yeah, I think we all do, right?
Uh,
The One of the things you talked about was hormonal regulations, and I find this to be such a common thing with Lyme patients, that we're just hormonal messes, right? Men, women, old, young, whatever, right? And it just messes with our hormones. So that's something you specialize in as well. We've had, Holtorf, his clinic is huge on bioidentical hormone therapy. So we had him, him and his peers share that when they came on the podcast. Other people think it's not such a great idea. What are your views when it comes to hormonal regulation, Lyme disease, and the best way to address it?
Well, like everything, it needs to be an individualized risk benefit analysis. So personally, I used some topical progesterone for a few years, and then I had an early breast cancer, and that was both estrogen and progesterone sensitive. So I was like, okay, no more topical hormones for me, even if they're bioidentical. Now, my husband's an OBGYN. Lovely. It's lovely to be in practice with him. So I refer patients to him because he's much better at hormones than I am. But I do see hormones extremely important. One of the turning points in my health improving a lot was when my circadian rhythm got normalized, when I could sleep at night and wake up at 6:30 in the morning when the sun started coming up, just automatically without an alarm. And like all of a sudden, so many other things just fell into place. And I think that's multifactorial. I mean, this goes back to what you were talking about earlier. Like we live in a very artificial society with toxins, and there's a lot of like plastics that are like fake estrogens and that will affect us. And even these days, one of the hip things that a lot of these like eco-conscious clothing companies are doing is making plastic yoga pants. And it's like, oh my God, you're gonna absorb that stuff through your skin. It's a really bad idea. I mean, it's lovely, like because of wanting to reuse plastic, but it's really bad for your hormones. But I see regulation of hormones really help get the circadian rhythm working, and then that helps support proper immune function. And God, when you can sleep, you feel so much better, when the insomnia starts getting balanced. And I mean, mold toxicity will wreak havoc on hormones. That's one of the biggest things I see is, and a lot of times we've had patients who knew they had chronic Lyme, but didn't realize they had mold. And, when you're on long-term antibiotics, or I'll just give you an everyday example that a lot of people can relate to. Let's say a woman has a UTI, she takes antibiotics for like a few days. What happens? You get a yeast infection, right? So when you take antibiotics, you can facilitate growth of Candida, Aspergillus in the nasopharynx and the GI tract. And then that can, mold toxicity can affect the immune system, neurocognitive effects, like you were suggesting earlier when you said you interviewed Jill Carnahan. I see gliotoxin in particular cause ADHD and anxiety type of symptoms, like where people can't focus. And they'll come in needing psychiatric med, and you get rid of the gliotoxin, and they don't need like the medication for focus and stuff like that. It's fascinating how all the physiology is interconnected.
Yeah, we had Dr. Roseanne Kapana-Hodge on, who is we titled the podcast Calm Brain, who really helps in the mental health world in the Lyme community with children and adults. And it was fascinating to hear all of her findings about Lyme and all the various things that go along with it, including Bartonella being one of them, causing these neuropsychiatric conditions, and how she can help people in that realm of neuropsychology. But what's interesting there is, you also touched Bartonella keeps coming back, right? And
Yes.
and the theme of Bartonella and cancer. So I can't help but think about, people listening are probably, oh, here we go again with Dr. McDonald. We love Dr. Alan McDonald. So we've had him on, and we talked about, and Ava Shoppy as well, both ILADS members. And they talked to us about their research and the relation between cancer and Bartonella. So Ava Shoppy was more the Bartonella and Lyme from our chat. I'm sorry, Bartonella and cancer from our chat. And McDonald was more, he focused on the Lyme and cancer side. But I mean, it sounds like you really agree, and that there's a lot of preliminary studies that are out there that prove this connection between cancer and tick-borne illnesses, but also, a wide array of neuropsychological conditions and tick-borne illnesses, right? That's a theme we keep coming back to, I feel like, throughout this interview,
And this is not a unique concept, for example, H. pylori is associated with gastric cancer. And, they first published the research for that in the 1980s. And the guy who did the original publications, he got laughed at. They thought he was crazy. They thought first that they didn't think acid reflux was caused by H. pylori. And we know H. pylori can cause acid reflux. And then when they found that there were associations of H. pylori with gastric cancer, it was like, oh my gosh. And then the other one that's a common everyday example is HPV, human papilloma virus, is associated with cervical cancer.
Yeah.
And there's a lot of these pathogens, let's call them exterior pathogenic factors, which can cause some chronic inflammation and immune dysfunction. And immune system is key to cancer. This is part of why some of the newest cancer treatments are all immune modulatory. There's a treatment for lymphoma, where they literally take your T cells and train them to attack the cancer and then put them inside you. It's fascinating.
Yeah, we had Dr. Omar Morales on, another one I'm sure you know. He's brilliant, and he talked to us about the cancer and tick-borne illness and Lyme relationship as well, and some of the work he's doing on his end. And then we had Dr. Leo Shea III on, who is another neuropsychiatrist.
That guy's great too. I love him.
Yeah. he's out of New York City, and boy, oh boy, was he a fascinating interview. And he made a really bold statement that we tell everybody and say, respond to this. And everybody's like, because he goes, I believe, and this is coming from a neuropsychologist, right? He goes, I believe that every single psychological condition, depression, anxiety, schizophrenia, everything in the brain that we have all these labels for has a pathogenic root cause. And it was sort of like a broad brush. So when we ask people, well, I think a lot are, but maybe not all. So I'm curious, what are your views? That's a pretty bold statement. And I'm just curious what your thoughts are on that.
So, when I went to medical school, I graduated, as I said, in 2004. We had the DSM-4 then. Now there's the DSM-5. And how do you diagnose somebody? Well, you open up this book and there's a list of diagnostic criteria. And the diagnostic criteria is simply behavior patterns. So like obsessive compulsive disorder. Oh, do they, are they a checker? Do they check to see if they like lock the car door? Do they walk back like 3 times to see if they turned off the stove? That kind of thing. And so it'll be a list of behavioral symptoms. There's absolutely no pathophysiology for how you make psychiatric diagnoses.
Yeah.
And this is where things like the Cunningham panel come in.
Yeah.
Which is fascinating, where you can actually look at antibodies against the brain and nerves, and they're often driven by chronic infections. And this is debated right now. There's some doctors who don't think things like pandas exist. So pandas is a problem that you often see in children. The classic example is after they get strep throat, all of a sudden the kid will start exhibiting unusual behaviors. They won't want to go to school. They'll regress to a younger age. So you'll have an 8-year-old that starts acting like a 3-year-old. They'll have food avoidance. And, I've had like 8-year-olds get diagnosed with eating disorders. And it's like, no, they have pandas, their brain's inflamed. And then they'll have a new onset, like behavioral changes. Sometimes there's tics, sometimes there's Tourette's type of stuff. Sometimes it's like a true like psychotic break, and it's all caused by infection triggering an autoimmune response that's attacking the brain. And so and that's pandas in children. And then you can have this similar thing in adults, except I just call it autoimmune encephalitis. But since I graduated medical school in 2004, there's been more than 20 new types of autoimmune encephalitis discovered in the literature. And I think we don't know what a lot of these antibodies are. I also suspect things like fibromyalgia. I suspect that that's an antibody against your connective tissue, and we just don't know what the antibody is. We don't have a lab test, but just because we don't have the lab test yet doesn't mean that it's in your head and there's not a pathophysiologic reason for it.
Yeah, so I wonder, like with fibromyalgia, is it a specific antibody that we don't know what it is and what's causing that, attacking the collagen, or is it a variety of different things, potentially, Lyme and Bartonella and different conditions that are, classified in a large bucket, but it's maybe a collective thing of 10 different, infections that are causing this inflammatory response in the person, or whatever this immune response is. And they're saying, here's a label because we don't know what's wrong with you, right? And collectively, it's 10 different things depending on who your sample is that you're pulling out of that bucket, right? Because I feel like there's definitely a root cause, we just don't know, and that's the idea. It's a syndrome, which means a illness of no known cause, right? I mean, that's the sad part about it.
Yeah, and I think that's one of the problems with the medical system. It's doctors are very uncomfortable saying, I don't know. And I think it's a huge issue. And I think there's a professional way to tell somebody, look, I don't know what's wrong with you. I'm sorry you're going through this. It doesn't mean that, it's all in your head. And I think part of it is the way people are trained. There's hierarchy, there's an emphasis. I have deep empathy for physicians working in the conventional medicine system, because most of them I know are very unhappy. They're stuck with these, conglomerates of insurance companies and following protocols, and there's fear of being sued. And I think a big part of it is lawsuits. So there's like And I think standards of care are important, but there's a lack of creativity, a lack of being able to think outside the box, and a deep lack of questioning of root cause. I was in a bit of a troublemaker in medical school because I would constantly ask like the etiology. For example, there's this like syndrome called costochondritis in Western medicine, and like supposedly it's like chest pain, and the person come in, they'll have like chest pain, and you do, you know, a heart workup, nothing's wrong with their heart. You do a stomach workup, nothing's wrong with their stomach, nothing's wrong with their lungs, but they still have this chest pain. And so there's this thing called costochondritis, and the theory is it's so like crazy. It's the idea is that they have inflammation of the like the sternum, and I'm like, well, what caused that? Why did that happen? And you know, the treatment is just to give them Advil and tell them they have costochondritis. But I found like with like acupuncture, you can actually treat it, and you know, some Chinese herbs and stuff like that by addressing the imbalance and stuff like that. But I've never gotten a good explanation for what's the etiology of costochondritis. It's kind of like a wastebasket term, very similar to fibromyalgia. And it always kind of makes me chuckle. My husband and I have a joke. We just kind of say costochondritis.
Yeah, you know, some good news in that front, which is, you know, we know, and I think you probably know as well, we had Dr. Burascano out east, you know, who we had on the podcast and share with us that he, you know, he's since retired, but he was sued, almost lost his medical license. The New York State Medical Board came after him. He had his patients, yeah, they had to fundraise over $1 million for him to fight the legal fees, and he still got a slap on the wrist. We had Dr. Marty Ross come on here and tell us how his state medical board came after him as well. So it's just that's sad in itself. But there are some states out there. I believe Illinois. It is definitely Illinois because Jenny Bottaccio came on to share this with us. That Illinois now has laws in place at the state level protecting doctors who treat Lyme to not get those consequences or punishments anymore. So we're seeing a trend there, and other states are starting to pick it up. I think Pennsylvania is looking at doing one right now. So we're seeing more protections being put into place, and I think Lyme and the severity of Lyme is becoming more well known. Now, granted, I live in New York on Long Island, where it's pretty prevalent. But I mean, I wear my Tick Boot Camp t-shirt, and I went to the eye doctor, and he goes, "Oh, Tick Boot Camp, Lyme disease, oh, that can be really serious, huh?" And I didn't have to say anything. He just knew right away how serious Lyme disease could be. So the fact that we're hearing that and we're seeing that
That's great.
shift, I think it's a good sign, you know?
No, that's huge. That's huge. And then, you know, this is one great thing with the databases that we now have access to and stuff like that. I don't know. I'm sure you guys have had stuff about, you know, testing for ticks and stuff like that. But Pennsylvania, they have a state tick lab where you can, if you get bit by a tick, you can mail the tick off to be tested for Borrelia. If you live in Pennsylvania, it's free. But what's cool about it is they have a map on their website, and you could go to your state and you can see how many ticks, what percentage of ticks actually had Lyme. So if you go to like the Florida and you hover over Florida on the Pennsylvania Tick Lab website, something like 30% of the ticks tested in Florida had Lyme. And so this is like where, you know, people think there's no Lyme in Florida, but there's Lyme all over the place.
Yeah, even on the beaches, we had a study out in the Hamptons where they studied all the ticks. Well, they did a study on the beach in the sand, and they found ticks all in the sand in the beach. And I believe it was like half of them were carrying Lyme bacteria on the beach. You know, people think, oh, I have to be in the beach grass or I have to be in a grassy area. If you're laying in it, but no, they were there, right? And you know, to give a shout out to a lot of the great universities, the University of Rhode Island, you both may know this, they have their tick encounter, and they have a great. We've had them all on the podcast, all the people from the URI, and if you get bit by a tick, you can take a photo of the tick, send it off to them. They say within 24 hours, but frankly, I've done this a bazillion times. They send it back to you generally within a few hours, and it's a full disease risk assessment report and a tick identification. You know, the tick is an adult Lone Star tick. It's a nymph, you know, dog tick, whatever, right? And it looks like it's been engorged on you for 2 days. And these are the things you should be aware of, and bring this to your doctor. And these are the symptoms to look out for. And these are the, you know, where based on where you live in our studies, it's really wild the resources that are out there to help people A, avoid ticks, but also B, react to a tick bite. You know, we have a tick bite blueprint on our website as well, which is a step-by-step guide of what to do if you're bit by a tick. And it includes links to, you know, places like the URI and tick testing companies and things like that, but there are a lot of great, I'll call them, university public funded resources that people can use that they simply don't know about. So we're seeing more of that as well.
I've actually given your website to patients about what to do if they get bit by a tick.
Thank you. Yeah. So I know we've had you quite a while. I did have one more question that I circled that I didn't want to forget to ask you.
No, I
which
feel honored to be on your podcast, especially
Yeah.
with the amazing people you've had on.
Thank you. The biological photomodulation. Can you describe what that is and how you use it?
Yeah, so red light therapy is a type of biophotomodulation. So is getting up early and watching the sunrise. They've done studies that show that methylene blue, for example, will increase its antibiotic effects when it's exposed to red light. So when I had pretty bad neurological symptoms due to chronic, tick-borne infections, I was taking methylene blue and doing methylene blue IVs, but I would combine it like timing wise with red light therapy to help facilitate everything.
Yeah, it's so funny because we just had Dr. Nicola Ducharme, who we had on the podcast a couple of years ago. We have a Lyme hackathon going on right now. And every day we post a Lyme tip from somebody in the community, in a minute or less video. And her Lyme hack this year was methylene blue. And she went on with her blue tongue, right, in the video. It was a really good video. And she talks about red light therapy as a way to enhance the effectiveness of the methylene blue treatment. So it's spot on to what you're saying here. Now, like, what is the science behind that? Or I don't want to make you go too deep, but like, what's the idea of why does the red light therapy help amplify the effectiveness of the methylene blue?
Well, so there are molecules that react to light. So a common example is chlorophyll. And so within our body, we have similar types of protein as chlorophyll, where when frequencies of light hit it, the protein will actually change conformational shape. And these are called porphyrins. And porphyrins are light sensitive, but it helps with modulating all sorts of stuff within the body. The other thing that's fascinating is we will do methylene blue back to back with ozone. And they've done studies that show that when that will enhance each other, and also nitric oxide, and particularly when nitric oxide is combined with this stuff, you can actually release like biological light, which is fascinating. But yeah, biophotomodulation is just like the fancy science term for things like red light therapy.
Dr. I can't tell you how wonderful this interview has been. We've had people on like Dr. Cameron, who is more west leaning. We've had more people, other people on who are more far east. But what I really loved about this interview is you blended both, right? You had a PICC line, you did antibiotics. You are a Chinese herbal medicine master's degree student who is now using, all these Chinese medicine modalities in your healing, in your treating your patients. And I personally love when people use both worlds, because I think that's how we're going to get the best results, is combining West and East. Whatever works, let's bring it together and help our patients. Not, all antibiotics or all natural only. I think that's a little narrowing down our tool set we have available to help people. So this has been absolutely wonderful. Theora, I can't thank you enough for coming back to co-host. And Dr. Rowe, we're going to have to do more down the road to do awareness and get the word out there, because you were just awesome. And to our previous point, I just feel so relaxed and calm, and my nervous system feels wonderful right now. So I can't thank you enough, Dr. Rowe, for joining our podcast.
Oh, well, thank you. Like I said, it's an honor to be with you, because, I'm just a clinician. I'm not into research or anything like that, but I am obsessed with this stuff. I love learning about it. I love researching it. And I feel honored to be on your podcast with some very famous people who are big in the Lyme world and research